In this week's tip, we're going to go over, should you use a call answering service in your dental practice? Stay tuned. All right, this week's tip, should you be using a call answering service? So let's get into it. Let's talk about it. Now, I only want to talk about it from a new patient point of view. And, we could argue the merits of it from a regular patient point of view, but I want to talk about it from the new patient point of view. And if we think about the type of call answering services that you have options of, I've seen it grow and escalate. There's basically three. There's the phone tree, where you call somebody and there's options. There's the AI, like virtual assistant, and then there is a real live person who is a call answering service. So let's talk about these. The ones that I still see, believe it or not, and you may experience too, are the phone trees. And let's talk about that phone tree. How many times have you called a medical office? How many times have you called customer service? How many times have you called your bank and you've been put into that queue of phone trees? Right? If you're calling about X, press 1. Can you tell me a little bit about why you're calling? And then it tries to route you. Could you give me more? Could you tell me exactly? And all you're saying the whole time is what? Representative, customer service. Please just let me talk to a human. That's what a new patient wants too. It's really what any patient wants. But from a new patient point of view, they need to talk to somebody to make an appointment. So I personally don't like the phone trees. And I don't like the phone trees for many reasons, but from making hundreds of phone calls every single day, I can tell you that some of them are quite old and antiquated. And I think I even did a tip on this and I might have played it. They're kind of funny. You listen to it and the first thing they say is, thank you for calling Dr. Smith's office. And if this is a medical emergency, hang up and dial 911. And I'm always thinking who's having a heart attack and calling their dentist, and I know why it's there. It's some legal rudiment, someone from professional liability said we should put it there. But there was never anything in my State Dental Practice Act that said you had to do that. And then it would just get worse from there on out. Then we have all the options. Press 1 to talk to the hygienist and change your appointment. Press 2 to change your appointment from this hygienist to the other hygienist. Then billing was 3. Then insurance. If you're a new patient and you're listening to all this, if you made it this far, you're probably just hanging up. So that phone tree, all the options, it doesn't really make a whole lot of sense in this day and age. And in fact, as I make fun of this in every new patient workshop that I do, I talk about how someone got smart, some company got smart, and they only gave 2 options. You call and it was, if you're a new patient, press 1, everyone else press 2. And I thought, oh man, these guys they're really figuring it out. So I can't make fun of this anymore. And I press 2. Christina picks up the phone and I have voice over IP and it hangs up. So I call back and I think for fun, I'm going to press 1, new patient. So I do press 1 and guess who picks up the phone? Christina, the same human who picked up the phone when I pressed 2. So why don't we just have that human pick up the phone? It doesn't make any sense if you want to schedule new patients and it's all going to the same person. So as I'm making fun of it, in the new patient workshop, one of the clients is like, oh, you know why they do that, Jeff? They do that so they can track new patient phone calls. And I was like, yeah, except I just ruined their metric because I pressed 1, like every other person who doesn't listen to the message and just starts jamming buttons, So I will tell you, one of my biggest pet peeves is getting that branch, that phone tree. And so if you're that patient, be that patient for a minute. You have an issue, you want service, you really like the website, you like the reviews, maybe I'm in pain, and this is what I got, I'm just gonna hang up, guys. You would hang up. In front of you on your phone, because nobody's searching on the computer. You get this, right? Like everybody's on their phone. Hang up and they literally just scroll to the next person on the list and press that button. And that's the loss of a new patient. So I will tell you that during regular business hours, you should not have any type of call answering service. You're just putting off scheduling a potential new patient. And that goes for your AI virtual assistant, and it also goes for the real person. Now, the AI virtual assistant, it's not bad, it's not great, but as they start to ramp these things up, ultimately, what are we trying to do? When a new patient calls, what is the purpose of that? It's to get them scheduled, right? So we can look at, well, why is that happening? Why is it that I can't pick up a phone call and now I'm going to have an AI assistant picking up, or I'm going to have a call answering service? So there might be an underlying issue. And I'm going to put a link, if you want to talk about your practice, and we could go through a practice analysis and see where some of these issues may be. I'm more than happy to sit down and talk to you about it. But as we progress through the types of call answering services that we have, ultimately, there is a time for one, and I can see that. Maybe it's after hours, maybe it's during the weekend. They might make sense. But if we keep it confined, so let's just talk about confined. If we keep it to open business hours, we shouldn't have one. And furthermore, some of them are not your practice, and not in a good way, actually. People think it's just funny, but I made a phone call last week, and since I do, hundreds of phone calls in a week, I get to hear all different types of dental practices and how they answer the phone. And, for the most part, they are overworked, they're underpaid, they're doing 10 jobs, and they're curt, they're short, they're rude, they don't have time for me, and it comes through on the phone. I know when I'm talking to a call answering service because they're too nice. They're too pleasant, and that's maybe horrible to say, but it's true. And they're not what the patient's actually going to get when they talk to the office. Now, that's a problem, right? That I know the difference between a call answering service and a general dental office, general dentistry office. So that's how far off it is. And when I'm talking to these offices, I'll call and say, I remember asking, it's like, are you a call answering service? She said, yes. So she's just way too nice. Oh, thank you for calling. What's your name? Jeff. Oh, yeah. Dr. Smith, he's not available right now, but he's very interested in talking to you. He'd like me to get your phone number. Just too nice, right? That's great in after-hours situations. And let's talk about that. Where could you use it? Because there is a time and a place for everything. We're going away on vacation. We're closing the office and everyone's leaving. Okay, I get that. Fantastic. But just let's talk about day-to-day operations. Even though on our website and on our Google listing, we're going to put hours and times when we're available, it doesn't always mean that people are looking at it. And when you have an emergency, you might just call. Thinking this place is close to me, I'm going to get up in the morning, or they're going to get up in the morning and they're going to listen to their message and they're going to call me right away. We have clients that employ a call answering service, live human being, after hours and on weekends. They will see anywhere from 20 to 40 more new patients in a month because they're doing that. So in a short answer version, should you? If you're trying to solve a problem Monday through Friday, 9 to 5 p.m., probably not. That it's not the best idea. It'll work in a pinch if we really have an issue where we lost a staff member or we're just understaffed, somebody's sick. Okay, fine. After hours, I think it could work. So it's a yes and no. How are you using it? What were you planning on doing with it? I think that's where you would start first. And if you're finding that it's to cover during regular business hours, we have a bigger problem. And I do want you to call me. Book time on my schedule. We could talk about it. I'll tell you how we help solve this for all of our other practices. If you're thinking about it for after hours in the weekend, I think it might be a great idea. Try it out. See what happens in a month. Maybe you have an additional 10 to 40 more new patients, and then it's worth it. Okay, so that's my tip. So if you like that, click the like button, click the subscribe button, hit that bell so you get notified when we have more tips. See you next time.